Hello there, patients. Here's a short video on how to self-treat, doing some self-massage for swelling around the wrist. This was a request from a patient, and a lot of people could use this, so I'm going to make a video about it. So I recommend all kinds of different herbal liniments, lotions, poultices, that kind of thing, depending on what's going on in the area. So for this one, I'm just going to use a regular lotion just for glide. And certainly you can do that as well. So I'm just gonna use a fair amount on there. So we're gonna say, and for me you can see, just because of my line of work, I've got a fair amount, a little bit of swelling around this area here, which is, for all of our anatomists following along at home, the tendon of flexor carpi ulnaris. Which inserts over here at the pisiform bone. But you don't need to know any of that. You just need to know what to do. So we're going to start by just doing some gentle massage. And if you can see from the side, that's my depth. I'm just a little tiny bit below the surface of the skin because we want to be sort of at the fluid level here. And I'm just stroking toward the center of the swelling. So I'm sort of, you think of the metaphor of sweeping up a room. You're going to get all the dirt in the dustpan there in your little pile, and then you're going to sweep it away. So push toward the center of the swelling, just like that. And if it's on the other side, can get it from that side as well. And once you've done that for a few repetitions, you're going to press into the center of the swelling. And my pressure is just a little bit deeper here. You can see the depth I'm getting to. So still not really deep, not all the way down to the bone here, but just a sustained pressure like that. Hold for maybe 15, 20 seconds. And then release. You can come back. And now we're going to push in the opposite. We're going to push away from the swelling. And for this, you might like to have, if it's the hand, you can't see it here, but you might like to have it elevated. Might like to have your fingers pointing toward the ceiling, just so gravity can help you out here. And you notice now I'm pushing away from the center of the swelling. I'm pushing both proximally up toward the torso and distally toward the wrist. This is a little bit of a difference from Western massage intention, where you're only pushing toward the heart, when you're only pushing proximally. In East Asian sports medicine and traumatic injury medicine, we do things a little bit differently. So you're just thinking of spreading that swelling out, make it easier to recirculate here. You're pushing out, so distally toward the fingers here, and proximally toward the elbow. You can use whatever angle is comfortable for you. And if you like, you can add a little wrist motion in with this. That'll help pump the circulation a little bit more, but only if it's comfortable. And of course, can do the other side as well. All right, so now I've flipped the camera around here. And so we're gonna do a little bit more of a brisk technique now. So I'm gonna rest my hand here. So this is the angle you might want it at for the entirety of the technique. I just put it the other way for ease of viewing. So you're gonna use the meat of your palm here, so this part right here, and you're just gonna do some brisk, and again, very light, just on the surface of the skin. This is a circulatory technique, so we don't need to be getting really deep into the belly of the muscle here. And you're just sort of briskly rubbing toward the elbow, and now away from the elbow. And of course, you can do both directions like so. And now you're going to go crossways. And let your wrist be nice and loose for this. And you can assist with your wrist as well. And then lastly, I'm going to do some slower strokes, just proximally to finish. There you go.